there's just so much.
You're listening to a Mamamia podcast. This is Well Australian Women. Welcome to your full body health check. I'm Claire Murphy. I'm a journalist who loves nothing more than getting all up into other people's business.
And I'm Dr. Mariam, just hanging out, answering all those questions about your bits.
And that is why I love you. Today in the checkup, we're talking about something women know all too well. We're talking about burnout, how you identify it, how you deal with it, whether it's from the boss putting the screws in at work, if you're facing year 12 exams, or you're a mum who has to balance all the things. Today's quick consult, which is where you get to submit whatever questions you want to Dr. Mariam, we'll see us talking about a weird something that's happening to Kez. She says her foot is ringing like a mobile phone.
Kez, pick up the phone.
Or don't if you're standing upright, because that would be odd. But first, I heard the cutest damn thing about how Gen Alpha girls are talking about their periods, and I just have to share it with you. It's time to go to med school.
Welcome to med school.
Mariam, we're in med school. This is where I share with you a fabulous fact or fable that I've learnt about our bodies, or something around women's health, because my algorithm is like so completely messed up now that we make this show. I get served like a lot of very interesting things. But today it's more about health-related slang.
Mm-hmm.
How across Gen Alpha vocab are you? So like we're talking, 8 to 14-year-olds?
I'm learning from my nieces, but I'm not cool.
Okay, so we're talking about things they say like Riz, Sigma, Skibbity, Ohio, like
what?
You'd have to go and just get the Gen Alpha dictionary to figure that out. But I heard a really, really super cute story about how Gen Alpha girls talk about their period. So if you're not up to date on Gen Alpha, the oldest of them are around 14 right now, which means they are deep in puberty territory. And even though, look, we debunked this myth back when we were talking about periods that you don't actually sync up with your besties if you hang out with them for long enough. But when you do find out that your girlfriends do have their period at the same time as you, Gen Alpha girls call it Bluetoothing.
Oh, that's so cute.
Because they're synced.
Aww.
Like, is that not the cutest thing you have ever heard?
Unfortunately, we cannot blame the period Wi-Fi or Bluetooth.
Period Wi-Fi?
Connect, but why would you want to connect? Disconnect. No, you need those regular periods. No,
don't disconnect from periods altogether. But like syncing up is not, like it's not a thing.
It's not a thing.
We did discuss this.
Yeah, this misconception's been around since the 70s. No evidence to support it, but there's something weird in the air. You know, like last time we were recording, we all synced. It was crazy.
It is the weirdest thing because some of us who haven't had a period in a long time, some of us who were not due for our periods and some who were, we did get it all at the same time.
So whether it's biology timing or just a quirky coincidence.
Just the universe.
Or period Wi-Fi.
Period Wi-Fi, talking to our uteri.
Yeah, I love that.
Okay, it is checkup time. Today we're talking about something that I think many of us might have experienced, but we haven't really learned how to identify it clearly. It's a little something we call burnout.
It's time for the checkup.
Mariam, it is estimated, and I'm going to say maybe guesstimated because a lot of us don't actually talk about this or identify it, that 30% of the entire Australian workforce is feeling some form of burnout. And you might remember back in 2019, this made headlines. The World Health Organization gave burnout its official definition. So they say it's an occupational phenomenon resulting from excessively demanding workload pressures. But the thing is, you don't have to have some like high-paying, high-demanding gig in order to feel that burnout. It can come from being a carer at home, you know, between demanding kids and elderly parents, or maybe studying for your year 12 exam too. So, Mariam, how do we actually tell, though, that we have burnout? It seems like pretty much every woman I know, and I'm guessing yours too, says she feels so damn tired all the time.
Yeah.
But how do we know if we're actually experiencing burnout or if we've just been, you know, tired for the past 10 years? And is it even an actual thing you can be medically diagnosed with?
Yeah, so burnout can feel like an unrelenting exhaustion. So, and it's common for women to feel really drained. But it's not just about feeling tired. It's about that prolonged chronic stress that leads to the emotional, physical and mental exhaustion. And this reduced sense of like accomplishment with your task. You're feeling like you're not achieving as much as you have previously. And yes, it is medically recognized. As you mentioned, it's officially classified by the World Health Organization as a medical condition. In short, anyone can burn out, but not everyone will.
Okay. What then are the primary symptoms that we need to look out for to identify in ourselves first before we go see someone?
Exhaustion is generally the primary symptom we see.
Yeah, but we're all exhausted all the time.
Right. All the time and feeling quite drained. You might have a brain fog, so you've got this poor concentration and memory. You might be withdrawing from social events and people that you usually wouldn't. You'll have an unsettled mood, so you might be feeling anxious, irritable and on edge. You're not performing at work like you used to. And that's generally due to symptoms like fatigue, and you're just not feeling that accomplishment or drive to perform.
Especially if you are someone who is very driven, right?
Yeah,
if that
that's right.
starts to pivot away from that, you know something's going on.
And you're not satisfied with your work either or being at work. You feel isolated and disengaged. You're becoming more upset or tearful at work. You're making small errors or lapses in judgment, and you might see that you're being late to work, you're taking longer breaks, or you're taking more days off. They're kind of a little bit of warning signs. And you just kind of have this increasingly negative or cynical outlook. It can also lead to like physical symptoms as well. And that's like disrupted sleep, headaches, muscle tension, and even digestive issues. So recognizing these symptoms are really important because, you know, we know that burnout can take a while to treat. So it's really important to act promptly. And if you kind of identify with any of these symptoms, seek help early.
Okay, so a lot of the symptoms that you just listed off, they suspiciously sound like quite a few other things that we could potentially be dealing with mental health issues. So how do we tell the difference between burnout and, say, I don't know, anxiety or depression?
Burnout and depression definitely share some overlapping symptoms.
Yeah.
So, you know, there might be the fatigue, the loss of motivation, that emotional exhaustion. However, there are key differences that we can help to distinguish the two. So in depression, you kind of experience this persistent sadness or hopelessness, whereas burnout is more about feeling frustrated and exhausted, specifically with those carer or work-related roles. And, you know, burnout is often the result of chronic stress, typically work-related or carer-related, whereas depression impacts all areas of your life, including your relationships, and it often stems from deeper issues and like that lack of self-worth or self-esteem. Personality traits play a big part in this. So we know perfectionism, imposter syndrome, they also increase the risk of burnout. But we know perfectionism actually lowers the likelihood of depression because they tend to avoid stressful situations and try to maintain control, which is really interesting. It's also possible for someone to experience burnout and depression or anxiety, all three simultaneously.
Gosh.
Either way, see a healthcare provider, getting that diagnosis and access to care, which a lot of the time is quite similar, is important.
Okay.
Yeah.
Of course, the way that we ask this of you each week is, how do we then take this to our GPs or healthcare professionals? Because like we're all for going in and saying, doctor, I'm exhausted, but like how do we let them know that it's more than that?
When you see your GP, come with information. We love information. It's just going to make the process so much easier. So track your symptoms, write them down. How long have they been present? What are the stresses? Is it work? Is it caregiving responsibilities? How has it been affecting you? How has it been impacting your quality of life? What symptoms are you feeling physically? Is it the sleep deprivation, muscle tension, digestive issues? And emotionally, how are you feeling? You're feeling more negative. While misdiagnosis between depression and burnout can happen or, you know, might take a few consults to get that right diagnosis, we should also be excluding medical conditions which can kind of look like the two, like anemia or an underactive thyroid. And sometimes they can also exacerbate those conditions. So it's important to go in for that full comprehensive history exam and investigations. Once a diagnosis has been made, so we want to put effective support strategies in place. And treatment for burnout often includes a combination of self-care strategies, stress management techniques, and in some cases, therapy or counselling. So it's amazing that we have the right to disconnect laws here in Australia. So like establishing boundaries with your work and home environment.
Oh, that is
really,
something we
really
all
important.
struggle with, yes.
Learning to say no, delegating tasks, and a good doctor will always prescribe lifestyle changes. You know, improving and prioritizing sleep, having regular breaks at work, exercising, eating a well-balanced diet. I know there's a lot of about mindfulness, but it works. Practicing meditation.
It's not woo-woo, right?
It's not woo-woo. There is science behind it. Those deep breathing exercises, being present in the moment, even if it's just setting aside 5 minutes a day for mindfulness and meditation, it will make a significant impact. If deeper factors are at play, like perfectionism, maybe working with a psychologist might really improve your outlook. You might also be referred to a mental health professional or a support group for burnout.
Now, I don't often recommend going to TikTok for any kind of health advice.
Yeah.
But I do love it. Anna Kapersky is so funny.
She's hilarious.
She talks about burnout all the time with like a ton of lol on the side. So like maybe we'll get like this bit of advice from her.
I am burnt the fuck out. So whatever you think I can handle today, I can't. So let's just go for a no things day. Please. Thank you. What? It's called manifesting. Look it up.
So that is Burnout 101. But coming up in the quick consult today, as we mentioned earlier, Kaz is concerned that her foot is ringing. Look, I promise this will actually make sense when you hear what's going on. But next, we're going to speak to clinical psychologist Shuktika Bose. She's going to give us the latest on how to identify, treat and recover from burnout that you can get whether your job is fast-paced, stress-inducing nightmare or the dullest, most monotonous, repetitive thing in the world. So burnout is something that many of us have experienced and maybe not even really known about it. It can look like a bunch of other things, anxiety and depression, and it can be a tough one to pin down. But that is why we invite experts into the well space with us, like clinical psychologist, educator and speaker Shuktika Bose. I caught up with her the other day. She's here to help us out. I just wanted to start off by asking, when it comes to burnout, what physical things are we looking at happening to ourselves? Like if we can sit down and take a log of our physical symptoms, how do we know that burnout is the cause of these things and what can they cause?
Yeah, so if we're thinking of burnout, it's really important to start off by recognizing that burnout isn't necessarily about overworking or about stress itself. It's actually about prolonged stress without recovery. So if you're trying to imagine an engine in a car that's running without the fuel or the time for the car to stop, you start to notice inherently some issues with the car. So when we think about our body, we start to notice obviously elements of fatigue that kicks in, and long term, that might end up with issues with your immune system, which is why we notice we start to get a little bit sick. You might notice digestive issues as well, or gut health issues. You might start noticing some issues with your heart as well as a result of the fact that we're pushing on it for so long without that time to rest and recover.
There is a lot of content out there on social media talking about burnout, and there's a lot of people who say things like, burnout takes 1 to 3 years to fully recover from. Is that true?
The short answer to that is it actually depends. So honestly speaking, when we think about burnout, it depends for how long the car has been running, for how long the symptoms have been going without a period of recovery. So if it's a mild state, it might take 1 to 3 months-ish sort of, but the longer you have been running, the longer the period of time you're going to need to recover.
Do you have to be experiencing major levels of stress to experience burnout, or is it any level of stress as long as it's over that prolonged period that you talked about?
Yeah, it's exactly as you said. It is that prolonged period. It's not necessarily extreme levels of stress. It's actually that sense of chronic depletion. It's the leaky bucket that's not being refilled. That's what can cause those burnout symptoms.
And do we see this happening more often in women than men? We know that women do maintain the mental load quite a bit more in many sectors of their life, whether that's at home or at work or at school even. Do we find this is something more common for women than men?
Well, evolutionarily speaking, women do tend to take on more of that carer role. And the Nagoski sisters, who are fantastic in the space of burnout, call it the human giver syndrome. And so that concept of the human giver syndrome, which tends to fall a lot on women as opposed to men, generally speaking, means that, yes, a lot of the burnout symptoms, which aren't just physical, but there's all of those cognitive and emotional symptoms as well, tends to happen more to women.
Can we talk about those cognitive and emotional symptoms? What are you looking out for when it comes to burnout?
Yeah, well, brain fog is a really big one. Where have my keys gone? I can't find my keys. They were just there a minute ago. Those sorts of things over a prolonged period, of course, when it comes to the cognitive side. Memory issues as well, again, with the keys, for example. If we're thinking emotionally, we tend to notice that our tolerance for things reduces, which means that we can become more irritable. We can also become more hypervigilant and quite anxious as a result of, I thought I knew where XYZ was. So they're all really very much connected with one another.
Is burnout inevitable if you're in, say, a high stress environment like an executive role in a company that requires you to work long hours or something that's really quite stress-inducing? Is it inevitable that burnout would come with that?
Inevitable is a really interesting word. I don't think that it's necessarily inevitable, but I would say that it's more common in those sorts of careers. It's really important to note that irrespective of the career that you're in, if we don't have the systemic things in place to manage those stresses with rest, with that recovery period, irrespective of your career, you will experience those symptoms.
What about academic burnout? It does seem that a lot of students, especially those facing their Year 12 exams, experience burnout. Is this the same as somebody who is under prolonged stress at work? Are we talking about the same thing when we say burnout? Is it the same for both?
Yeah, that's such an excellent question. We tend to forget about the academics and the students who are experiencing these symptoms. Perfectionism and the need for everything to be right, the fear of failure, all of those things really do play a role in the emotional and mental load that we take on. And absolutely holding on to that for a prolonged period of time can and will lead to those burnout symptoms too.
Along social media lines, again, I know a lot of them suggest that rest is a really important part of dealing with burnout, but there's going to bed and then there's resting. Like they might not necessarily be the same thing. How do we tell the difference between good rest and not so good rest when it comes to trying to recover from burnout?
I love teaching in my trainings that I'm all for you taking a sick day if you need that, but I'm not for you spending 8 hours on TikTok in bed as a result of that.
Yeah, okay, fair enough.
So it's so important here when we think about rest that it's actually rejuvenative and it's recovery based. So that means staying off your phone and doom scrolling while you're in bed. It's having a relationship with your bed that is, I am here for sleep, I am here for rest, I'm not here for the doom scrolling. So the same for if you decide to rest on the couch, for example. And rest doesn't necessarily mean sleep. Rest can also mean doing something that's stepping away from the high stress environment. For example, reading a book or listening to some music.
What about professional help, Shuktika? Like, is it something that we'd maybe see a therapist for? Is it someone we would see a psychologist, a psychiatrist? Like, who do we reach out to if we are suffering from burnout?
Yeah, well, as a clinical psychologist, I would most definitely say that seeking professional help can be really, really beneficial for those experiencing burnout symptoms. I myself do have several clients who are on their burnout recovery, as it were. And I think the benefits of therapy can be that it provides a platform for sharing things that maybe we don't feel comfortable speaking with others about. Being in that space can also be with a professional who can help to reframe some of those thoughts, coming at it from an external angle away from your everyday life. I think it's also really important that you learn some of the strategies that TikTok and social media can help, but being in a safe space with therapy gives us a very clear platform to practice those together and work out what's working, what's not working, and make those tweaks that are really personalized for you.
What lifestyle changes can we make to try and help either avoid burnout or recover from burnout?
Changing your job isn't necessarily the answer. People will think, if I just leave my job, everything will be fine. Unfortunately, what we notice is when you step away from a stressor, the stressor may be gone, but you're still holding on to the stress within your body. And that is why we talk about completing the stress cycle. And that means allowing your body to know that it is safe for you to let that stress go because you are okay. And that actually means doing things like healthy movement. That doesn't necessarily need to mean strength training. It can mean going out for a walk in the afternoon sun. It can mean making sure that the food that you're putting into your body is really nourishing and nutritious for your soul. It's ensuring those things like a good night's sleep. And a good night's sleep can mean the elements that you put into your sleep routine prior, the really restful music, a nice candle, the scents. All of those sorts of things from a lifestyle perspective can help. Alongside that, setting boundaries, as they say, but also setting up your own expectations for what you're expecting of yourself in a workplace. The work is always going to be there. That to-do list, as soon as you've ticked off all of the items, guess what? Tomorrow another 50 items are going to show up. And so with those lifestyle changes, it's actually about rethinking what is most important for me.
Can burnout be linked to other mental health conditions? Because a lot of these seem to go hand in hand, like ADHD, anxiety, depression. Does burnout link up with things like that, like they do?
Absolutely, it can. If we're thinking about the long-term impacts of burnout, the symptoms can be quite consistent with what we might see with anxiety or with depression, with that low motivation, the low mood. And so a lot of the treatment options can be quite similar from a cognitive or a therapeutic perspective as well, re-engaging with things that really bring you that joy and sense of this is why I'm here.
If it's not me experiencing the burnout, but I can see the signs, say, in a colleague or a school friend or another mum, how do I support that person who's in the midst of that?
The first thing that you want to do is providing a space for them to feel safe to actually tell you what's going on for them. And that doesn't necessarily mean, hey, I think you've got burnout. Here is a worksheet of things you can do. It might actually be, hey, how are you feeling today? It looks like you might be going through some stuff. Is there anything you want to talk about? Or I'm here if you want to talk. Having a space where someone can feel safe to say, you know what, I'm actually not okay. I'm having a hard time. Then we start asking as ourselves as the support person, what is my role here? So that doesn't necessarily then mean jumping into a solution. It means, what can I do to support you? And that might mean, I just need you to listen. I can find a solution on my own. Or I actually don't know where to start looking for help. Great. Then I can be that person that provides support. Or, you know what? I'm not sure I have capacity right now to be that person, but let's see who can support you. So there are a range of options that you can yourself, if you have capacity, do to support someone who's going through that.
How do I prevent burnout? If I know that I'm going to be in a prolonged stressful situation, whether it is studying for year 12 exams, or whether it is I'm about to become a new mum or a mum again, or if, work is work, how do I prevent myself from getting burnt out?
Yeah, when it comes to prevention, acknowledgement, recognition, reconnecting with the things that are important to us, absolutely critical. So as I said with the stress cycle, when I know that I'm going to have a very stressful day, I know that at the end of that day, I have to do something that allows me to complete that stress cycle. For me, at the end of a long clinic day or a training day, I will go for an afternoon walk. That'll be me, 45 minutes, maybe even half an hour with my headphones in. Sometimes I'll send voice notes to my friends, and that is a double whammy because it allows me to have that afternoon sun releasing the stress cycle and also that social connection of re-engaging with my friends. That's a really helpful thing when I know that it's coming. Another thing is telling the people around me what's going on. So, hey, next week or over the next couple of weeks, it's actually going to be quite a stressful time and I'm going to need some additional support. I might not know what that looks like right now. Can we brainstorm together as to how we can make sure that I'm going to be okay? And so when I'm okay, I can show up for you better too.
A really big thank you to Shuktika Bose for helping us better understand our burnout experience. Miriam, did you get a better understanding of your own? Because you're a doctor. We know GPs get burnout all the time, right?
Yeah, well, especially female GPs. We see a lot more complex presentations. Our consults are a little bit longer.
Yeah.
We're generally a little bit more emotionally invested with our patients. Then we go home and we've got that carer role. But, in saying that, my sister is a single mum and she's got 2 beautiful kids and she's experiences burnout much in the similar way that I do. It can look identical with, for people in the caregiver roles and people in the working environment. And a big part of that is that human giver syndrome that she was mentioning, which is where women are often experiencing burnout because they're setting aside their needs for those around them, which is really, really sad. And then we have that mental load that we carry.
And look, we're not going to drop anyone in it here today, but we did have a conversation off air about certain people in our worlds who take time out for themselves to better their own mental health. Look, it may or may not be our husbands, so we're not saying anything about that. But the thing is, when they take time for themselves, it takes time away from us to be able to do something for ourselves. So some really important conversations have to happen now, right? Not just with those people around us to make sure that we are allowing time for ourselves, but with ourselves, because we need to tell ourselves to do right by ourselves, right?
Exactly, and complete that stress cycle.
Okay, it is quick consult time where we are finally going to find out why Kez thinks her foot is all of a sudden taking calls.
The doctor will see you now, just through here to consult room 1.
Quick consult time where you can have your burning health queries, sometimes literally, answered by our own Dr. Mariam. But first, Mariam, you know what to do.
Thank you for waiting. How can I help you?
If you do have something you want to ask our Dr. Mariam or any of our experts, you can just send us an email. It's an easy one, well@mamamia.com.au. Or you can leave a voice note. You'll find a link to that in the show notes alongside a link that you can click if you want to do this anonymously, because we know sometimes some of these questions can be sensitive. Kez, though, has a very unique problem. Let's hear it. Here we go.
Okay, this might sound a little bit weird, but I think my foot is ringing. Because the other night I woke up and the bottom of my foot was just buzzing, kind of like a phone vibrating, you know, like right on the sole of my foot. It wasn't tingly or itchy or numb or anything else. It was just vibrating. It was so weird. God, am I just on my phone too much and now my brain's broken, or is this something I should be concerned about? It's been happening like every night for the past few nights and now it's starting to keep me awake. Help.
I mean, obviously, Kez's foot is not set to vibrate, right, Mariam? What's going on?
Do you remember Maxwell Smart?
Oh, the secret agent guy?
Yes.
Yes.
Get Smart. And he hit the phone in his shoe.
Oh, shoe phone.
I know, yeah.
Kez, do you have a shoe phone? Is that what's happening?
Well, Kez, it's unlikely your brain is broken. There are possible causes. It could be a form of paresthesia, so that relates to nerve irritation. And that could be from the sleeping position that you're in. Other potential causes could include a peripheral neuropathy, so that's like nerve damage from things like vitamin deficiencies or toxicities. We're seeing a lot of vitamin B6 toxicity from supplement use.
Oh, is that people taking a bit too much?
Yeah.
Okay, yeah.
And diabetes, excessive alcohol intake. There's also restless leg syndrome. That could be a possibility, or even stress and anxiety, which can manifest with physical sensations. Could also be something called fasciculations, which refer to involuntary muscle spasms.
Oh, just random.
Yeah, random.
Doing a
They
thing.
just start dancing.
Cool.
And they're triggered by factors like stress, fatigue, electrolyte imbalances like low potassium, dehydration, or if you're overusing your muscles.
So go eat a banana and
see
rest?
what happens. Other triggers could include like caffeine overload. They're generally benign and temporary, but because Kez has been experiencing for a couple of nights and they're keeping her up, I would definitely advise her to see a GP for a thorough history and examination and go from there, or just answer the phone.
Just answer the phone, Kez. Someone's desperately trying to get through to
Hello
you.
from the other side.
The other side is like, what, your left foot as opposed to your right? I don't know. Thanks heaps, Kez. We appreciate you sharing that. Really, like, weirdly interesting.
Yeah.
They're like, you might think that you're having the weirdest problem, but trust me, like, someone's
seen
having
it
something
all.
weirder. It's fine. Thank you so much for joining us today. Next week, we're going to be answering all your questions about any of the topics that we've been discussing in the last couple of weeks. So ADHD, anxiety, depression, and burnout. If you want to add your questions to the list, there's a link in our show notes that you can do as well. It's called The Waiting Room. And if you're interested in anything you've heard here today, make sure you sign up to the Well newsletter, because we will drop some info in your inbox and you will know all the things just like we do.
All the things.
All the things. And as always, the advice you've heard here today is general. It may not suit your exact needs, so make sure you reach out to your own doctor to get the info that's right for you. And we will see you right here for your appointment this time next week.
See you next week, and don't forget to complete your stress cycle.
Well is produced by me, Claire Murphy, our group executive producer, Georgie Page, and senior producer, Sasha Tannock, with audio production by Scott Stronach.
Mamamia acknowledges the traditional owners of the land we have recorded this podcast on, the Gadigal people of the Eora Nation. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander cultures.
Hi, I'm obstetrician Dr. Patrick Maloney.
And I'm Bridget Maloney. We're the hosts of The Kick,
the pregnancy podcast that breaks down everything you need to know about making and growing a tiny human.
We cover it all with expert information and evidence-based discussion based on our experience of running a women's clinic and being parents to 4 boys.
From morning sickness to birth plans, strange cravings to baby movements, listen to The Kick wherever you get your podcasts.